everyone, so this is Shruti Ahuja, MBBS student at GMCH Chandigarh. So in this video, I am going to address a very common question which is coming up nowadays, that how to visualize anatomy and how or should we cram or not, and how to attend the dissection hall classes and make them fruitful for you. So I hope these questions would mean a lot for you when you study anatomy, because anatomy is a subject it has so much syllabus in histology, gross, that embryo, osteo, and everything, right? So it has so much syllabus, so much content, and how to retain that and how to keep that in your mind till the end, right? So let's start. So visualization. So visualization, for that you need to use Netter's Atlas of Anatomy for gross, and for histo you need to use that D for Atlas of histology. Forgive me if I've pronounced it wrong. So learn the topic before it starts in the college. This is very important when you are doing anatomy, right? And attend the lectures and dissection in the college. And after that, when you are attending the lecture, then you are doing a revision kind of thing, right? And when you are doing the dissection, you are applying that theoretical knowledge in the dissection D hall or osteo. If you have already learned about femur in your at home from books or videos or whatever the resources, you are applying that knowledge second time in the D hall, okay? And if you have already learned about, for example, the arteries of the heart, the coronary arteries and all, you are when you see that specimen in the D hall, or when first time when the teacher is demonstrating that specimen to you, then it is a kind of active recall, and this kind of learning is will be very beneficial and fruitful for you when you will follow it, right? Then draw diagrams. You must have got your record books or practical files in anatomy, right? So you need to understand that you are not drawing diagrams just for the sake of completion. Draw diagrams. First, learn the diagram. First, understand it. First, know that yes, I have seen everything in the specimens and all. Then I have learned it. I know what is where, which artery is where, which vein is where, okay? Then draw the diagram as a practice. When you will draw the diagram, it is again a kind of revision. So the more number of times you tend to seek chances of revision, the better concepts you will build, right? Next is cramming. So we need to understand, we need to cram only the words, like the terms, examples, but not the concepts. Why this artery is here? Why this nerve is here? Why this branch is being given earlier, or this branch is being given later? Okay. So we need to know the concept as well. It is not so that anatomy is only rata. No. We need to know the concept behind everything. Okay. Then only we can relate to it, then only we can use it in future, right? So active recall is again very important. Now depend on your own notes. Cramming from someone else's note, like any platform notes, or someone like your senior or anyone's notes, is just waste of time, because you can gain marks in that past or periodic test or even in midterms, but you can't be held by the someone else note in the final exams, because in final exams you have such a huge syllabus, and you can just remember what you wrote with your hands in your notebooks, what you have revised from your own handwriting, right? And I hope you must have all made notes in NEET preparation times also, and most of the coaching centers would have, or you would have made notes from your own hands. And even in the school we used to make notes with our own hands, right? So we need to continue that habit and not leave that, right? Next, how to attend practical classes in anatomy. Now it is a very nice question, that sometimes the teachers don't have much time to address 150 students class at a single point of time, right? In practical classes especially. So we need to understand their point also. it is not so that you will be spoon fed by them at each and every point of class, of practical class or d halls. You need to depend on your own self, on your own self, right? So remember that there is no spoon feeding in medical colleges. So if your guides are not cooperative and they are busy, and it's genuine, right, because they can't address such a big class at a single time, so take your Cunningham's that dissector manual, or any of the dissector manual you are having, read from it. If you know, like if you have a good understanding, if you have read the topic before the practical class, then you can understand the Cunningham's very well. Then read from Cunningham, do the dissection if it is allowed. Terms and condition apply, but if it is allowed, then read it and then apply it. Okay, so what, the doubts which are coming up while doing the dissection, or doubts which are coming up while seeing the specimens or osteo or histo, just ask those doubts. Don't go with this question like, please help me do the dissection, right? Please help me learn this specimen. No, if you will ask, I didn't understand where this artery is, I can't find this nerve, it would be a better question for your guides or teachers, and they would surely address it. Okay, so take help from teachers and not just tell them to do the dissection, right? Because they are there to help you, not to just do dissection again and again. Some teachers are very cooperative, they are just so cooperative that they help you very much. But yes, we need to understand and we need to learn ourselves first, and then ask only the doubts. And this is the correct way of attending dissections and anatomy practical classes especially. So I hope you like this video, and if it helped you, then do subscribe the channel and share it with your friends, because sharing is caring.